Alright, so I'll come in the room. Hi, my name is Jessica and I'll be a nurse for today. We're going to provide privacy. Then we're going to sanitize our hands. Can you verify your name and date of birth? Right. Your doctor has ordered a Foley catheter. It's a tube that's going to be inserted into your bladder to help relieve any urine. Alright, so what you want to do first is you want to dispose the patient. And you're going to put on regular gloves because you want to perform perinatal care before and after you do the insertion. So what you're going to do, we're just going to pretend like these are the proper wipes that you use. So you would take it and you would have the patient legs where they're up and you can really get to it. So you're going to open the labia. We're going to wipe furthest away, trash it. I'm going to wipe closest to us, trash it, and then we're going to wipe down the middle, trash it, okay? So now that we have done that, what you want to do is dispose of those gloves. And then you're going to sanitize your hands one more time. Alright, so now we're finna open up our catheter tube. So we have the bag, we're going to open it up. We're going to take out our catheter. I'm at the box. I'm going to put that over there. So what you want to do, you want to open the flap that's furthest away. You want to sit it on your bedside table. That's try to go waist length. Alright, so you're going to open the flap that's furthest away. And then you will open this flap that's next. And then you will open this flap here. And then lastly, you will open the flap that's furthest away from you. And then you want to square off your area because this just makes everything easier to where you have enough room to where you won't break sterile field. So I'm going to take my gloves and we're just going to put those to the side. And we're going to take this. This is the napkin. It's just to help keep the bed and everything dry while you're performing the procedure. So you want to go around, not to break sterile field because now this is considered sterile. So next you want to put on your gloves. So you would take it, you would open it up. You want to open this here first. Next you're going to open this bottom and you're going to take it by the cuffs and open it like this. So you want to take it under the cuff here and you're gonna slide your hands in, making sure not to touch the outside of it. And you're gonna take the glove hand, stick it under, and you want to slide your hands in, just making sure you don't touch the outside of the glove. Just like this. So now you are sterile. So you gotta keep your hands up. Just gonna touch the camera for these purposes. But you would keep your hands above your waist because this is sterile now. And you're just gonna take your paper and you're gonna I'm just gonna throw it back here. You're gonna make sure you don't contaminate the sterile area. Alright, so now I'm gonna take this and what I'm gonna do is this is my lubricant. So we're gonna pour our lubricant, open up our lubricant, and you wanna put it down into the box. Alright, you wanna throw this away. Alright, so once you have your lubricant in your box, you're gonna open up your cotton swabs. Normally the cotton swabs are gonna have iodine or some kind of cleanser on it. We're not gonna use that. We're just gonna use these three, but you want to make sure they're sterile. So we're gonna put them there on our tray. Dispose of the trash. All right. So now I'm gonna take my syringe. So you want to take your syringe. This is my syringe, and then so you want to attach it to your catheter end. So you're gonna take the top off. and you're going to insert it like this. Just like that. So now that I got all my parts ready, we're gonna move over to the patient. All right, so we're gonna take the box carefully, and I'm just gonna sit it halfway, making sure I don't break that 1 inch margin. I want you guys to see, making sure I don't break that 1 inch margin. And so we're gonna sit the other side. Let me move my camera. Right. So you guys can better see. All right, I think you guys can see it there. So what I'm gonna do, is take it and I'm gonna center it middle to where I don't break that 1 inch margin, and you also wanna have enough space to where you can sit that there, just like that. All right, so now that I have that, what I'm gonna do is you'll take the cotton tips with the iodine on it, you'll spread the lips again, and you'll wipe furthest away from you, throw it out. I'm gonna wipe closest to me, throw it out, and then I'm gonna go down the middle, and I'm gonna throw it out. So what I'm gonna do, I'm gonna take my tubing out of the package, and you want to wrap your fingers around the tubing to where it doesn't fly everywhere, because that would be, and sorry, I just broke sterile field when I threw that package over, but normally you wouldn't want to do that. And so what I'm going to do is I'm just going to move this out of the way, over that way. And so I'm going to move my box a little bit closer. And so I'm going to dip my tubing inside. I'm going to dip it inside of the lubricant. And you want to take it, you want to hold the labia while you insert. And you would insert until you see P, and then you would insert 1 to 2 inches more on a female. With the male, you would insert it until you see P, and then you will insert 3 to 4 more inches, because male have a longer urethra. Alright, so you're going to take it, and you're going to tell your patient it's going to be some discomfort. Let me get you to bear down for me. So say bear down, you're going to take it. And again, you're not touching the patient. You're just inserting it inside of the patient. Just like so. You want to just feed that tubing inside the patient, and once you see P, you go 1 to 2 more inches, just like that. And so you want to hold it there, because if you let go, then it's just going to fly right back out. So you want to hold it there, and you want to take your tube, and then you want to inflate your balloon. So you're going to inflate it all of the way. You're going to inflate it all of the way. And then you're going to kind of hold that syringe. You don't want to let it go, because the water will just come back into the syringe. So you want to hold it just like this. And it's kind of hard. You have to kind of be quick at it. You want to hold it and disconnect. Just like that. And once you do that, you just want to let go. And then you want to make sure that that tubing is not going to come out. just like this. You don't want to tug light hard, but just tug lightly to make sure it doesn't come out. And so what you would do, oh, trash that. And what you would do is take it out, and then you would tape this here. You would tape it to the patient's leg, so it won't be in the way when patients are sleeping or anything. And then you would have your bag, and you would hang your bag on the bottom of the bed. You just want to have it below. You don't want to have it up. So you want to tie this to the bed and have that low. All right, so, and then this here, you have this. This is how you empty it. You would just release this down here, and that's how you empty it. And if you want to stop, you'll just push it to the other side, and that's how you empty it, just like that. I'm going to put it back. All right, so now I'm going to demonstrate how to take it out. So first, you want to alright, so with taking it out, it's pretty much, you're just going to take your syringe that you had, and then any syringe, you're going to hook it up, and what you're going to do is you're going to deflate your balloon. So as you can see, as soon as you put it on there, water starts to come. So what you're going to do is pull that lever, and you're just going to deflate your balloon. So get all that liquid out, just like that. Alright, and once you deflate your balloon, you're just going to tell the patient it's just going to be a little discomfort, not as much as it was when it was going in, but you're just going to feel a little discomfort for me, okay? Alright, just take a deep breath. And so you would then just lightly pull it out. It should come right out if the balloon is deflated. And so you would dispose of that. And then after you do that, you can go ahead and not take off your gloves. But you can go ahead and clean the patient up again. So you'll perform perineal care again on the patient. So again, you would just take the wipes. You'll wipe furthest away from you, throw it away, closest, throw it away, and down the mirror, throw it away. And then of course you would take all your trash and everything. And oh, I forgot to mention, when you have the catheter in and you see urine in the bag, you want to inspect the urine. You want to see what color it is, how much, and you just want to document that as well. All right, and so that completes the assessment. All right, well, thank you. You want to clean all this stuff up, and then you want to cover the patient back up. All right, thank you so much. And then just let them know the doctor will be with you in just a moment. All right, thank you.